Hi, I'm Lou Randall. I'm lead the Autism Connection of Pennsylvania, and Tammy is here as well. Morton is her last name, and we're really happy tonight to have Carol Miller and Missy Knox from Achieva. And Achieva is our parent company, and we get to collaborate with really cool people that know a lot of things. So we're happy to have them talk about medication management and how to avoid mistakes and how to manage all of that at your house for yourself, for your kids, or somebody that you're helping to take care of. So I will stop talking and I'll have you guys present. And just to let people know, we are recording, but later we're going to post this up with any kind of questions or anything like that taken out of it. So it won't be like nobody will be identified that way. Take it away, ladies.
Okay, thank you, Lou. Missy's going to do the slides for me, so I'll just keep deferring back to her. We have a little system worked out here, so we'll go back and forth a little bit. But as Lou said, we are working on a presentation for you tonight for how to avoid medication mishaps. Like Lou had said, my name is Carol. I'm the clinical director for Achieva Support. And Melissa, we call her Missy, is one of my newest nurses on the clinical team. Go ahead to the next one, Miss. So a little bit about the Achieva clinical team. Some people don't know we exist. We're getting a lot more popularity lately. But the team was pulled together in 2020, right in the middle of the pandemic in June of 2020, and put under one clinical director, which is myself. Supports were then expanded to include all programs within Achieva. And like I said, we're here tonight because we are available to support many of the umbrellas that fall under the parent Achieva umbrella. So we provide for Achieva support. We also Achieva resource, advocacy, EI, any of the programs. We've done presentations for the trust as well. So we are available for things like that. On the team is myself as the clinical director. I'm also an RN, and I have 3 other RNs and 1 LPN on the team. We provide a lot of guidance. Like I said, community supported living is our biggest program that we support because it's a 24/7 program. So we provide a lot of clinical guidance for them. We do triaging of emergency situations or overall medical conditions or changes. We do triaging for medication related issues, errors, things like that. We also work on facilitating a lot of the med orders for the people that reside in the community supported living homes. So we work on that as well. A little backgrounds, myself, I'm a long-term RN, dating myself now, but I've been an RN for 37 years. And I've been in management 28 of those. So, and then Missy, like I said, is one of my newest nurses, and Missy has a background in pharmacology, and then went back to nursing school because she wanted more hands-on patient interactions. So she just started with me in January, but she has a lot of good background there. My other nurses have experience in chemo, home health nursing, community nursing, pediatric vents, geriatrics. We have a lot of experience on this team. So that's just a little bit of our background. Next slide, Miss, please. Okay, some of the things we're going to talk about, we tried to pick some common areas, and we figured common fears was a good one to start with. And some of the fears that you have whenever changes are made with medications. Obviously, the anxiety with change is always starting something new. How's that going to make me feel? How am I going to feel after I'm on it for a while? Or how am I going to feel if things are changed while I'm on it? Whether that's the dosage, the frequency, things like that. So a lot of people will say, well, I went on the pill and I don't feel instantly better. So I'm not sure what the problem is. Depending on the medication class itself, some medications are slower to cause that desired effect, especially things like antidepressants, anti-anxiety meds. They're not as quick reacting as, say, a blood pressure pill that's meant to lower blood pressure and change the functioning of the heart. That will come about almost instantaneously. But some of the longer effects like seizure management, depression, anxiety, you can take up to 2 to 3 months sometimes to see a really great effect from that, like a mood change or a mood elevation. So those do take some time. Changes in how your body feels. A lot of times when you start a medication, you'll have some of the more common side effects seen. You may feel a little lightheaded. You may get a headache. Some people get digestive changes, whether that is constipation, diarrhea, nausea, even some vomiting, things like that. So it does change sometimes how you feel. Some medications don't recommend you operate heavy machinery or that you drive when you're on them. And some medications, there's no real indications for limiting your activities. So some things you think about: long-term effects of taking meds, excuse me. Will it predispose me to other conditions? Some medications, because they're excreted through the liver and the kidneys, you might have some of those types of injuries come about. They call it kidney injury now. They used to call it acute kidney failure. They refer to it as an injury now, but because the medications are broken down and excreted through the liver and the kidneys, a lot of times you'll see those organs can become involved, whether that's elevated levels through blood work, or whether that's, just other symptoms like urinary symptom changes with the kidneys, not able to produce urine or things like that, more frequent urination. So those are all things to kind of take into account, that there are some long-term effects when you're taking certain meds. Next slide, Miss. Okay, this was our cute little cartoon. What is this med and how should I feel when taking it? Some of the things we wanted to talk about was being comfortable enough to speak with your physician. Ask those questions. Why do I need to be on this? What can I expect when I'm on it? What will the effects be when I'm on that? Good and bad. What adverse side effects, what good effects? Is there anything special I need to do when I'm taking this med? Some cardiac meds you're not to have grapefruit with. Some things you can't take, like an antacid, like Prilosec or Nexium with some medications. Some have dietary things, like you shouldn't consume certain foods with it. So those are all things you have to consider. And to do so, you should be comfortable enough to talk to your physician and ask about those things. Asking him things such as, how does the medication work? Why do I need it? How long will I need it? Is this something I'm on for life, or is this just something short term? Obviously, if it's like an upper respiratory infection or strep throat or something, an antibiotic is a short-term use. If you're looking at a more chronic condition like diabetes or hypertension, it's a medication you're probably going to need to be on for quite a long time, if not the rest of your life. How will the doctor monitor for the desired effects? Is that blood work that's necessary? Like people that are on blood thinners, they may have blood work drawn, every couple of days, some every week, every 2 weeks, till they can get that right blend of what the medication should be, the dosage, to produce that desired effect. So a lot of people will ask, and I've had this asked, I'm sure Missy has as well, like, how long does it take the medication to work? So in other words, I get up in the morning, first thing I do is take my pills, quote unquote. How would I feel like right after that? A lot of medications are absorbed 30 to 45 minutes within taking them. Now this varies person to person. Some people metabolize things quicker in their body. So some people are a little more sluggish. So there are variables there. But for the most part, an oral tablet takes around 30 to 45 minutes. It's a little different if they're a coated tablet, like an enteric coated aspirin. You'll see those that are coated for easier digestion with the stomach and not causing some GI distress. Those may take a little longer to break down and be absorbed by the body. Obviously, things that go under your tongue or tucked in the cheek, which they call buccal meds, they're absorbed almost instantaneously into the bloodstream. That's why if somebody has chest pains and you take a nitro tablet and you put it under your tongue, it immediately is absorbed and hopefully releases that pain. So that's all variable, but it does take a little bit of time for the medications to get in there. As we had touched on a little bit right when we started the slide about desired effects, some medications you'll see that rather quickly. Like I said, with blood pressure medications, you might see a direct response. Diabetes meds, a lot of times it'll drop down the blood sugar levels, and that's a pretty quick response. If you have other things like anxiety conditions you're being treated for, depressive disorders, any type of psychiatric conditions that are more long-term effects and you need the medications, it does take, like I said, quite some time for a blood level to become therapeutic to where you get that desired effect. So there's all different variables. It's something you need to be comfortable to ask your doctor about. Some people, if they're on it a day or two, they get concerned. I'm not feeling better. Why am I even taking this? It's not working for me. And basically the response from your doctor is going to be, you have to give it a chance. You have to let it take some time. Having said that, some people go the opposite direction. They may react differently than the desired effect. I've seen people react to cold medications and become very hyper on them, not able to sleep, not able to sit still, which they call psychomotor agitation. So some medications may have a totally adverse effect and not what the pill's intended to do. So that's another conversation that you would need to have with your physician if you don't feel it's producing the desired effect. Cholesterol drugs are another one. I get asked about those a lot. Even family members have asked me about that. They typically take 2 to 4 weeks or so before you start to see an effect, because what that drug does is block an enzyme that the liver uses to produce cholesterol, which your body produces naturally. So those drug agents are made to suppress that so that it would keep your cholesterol levels lower and in check. So that's basically how it works. Because everyone's body is different, like I said, I could have an effect in 2 days and someone else may not have one for 10. It's very variable on the digestive system and how your meds are broken down and metabolized body to body. Common side effects, there are ones that you call classic side effects you see with a lot of medications anytime you start one new. Those are typically headaches, GI upset, which is gastrointestinal upset, nausea, the vomiting, diarrhea, or it can be cramping or constipation as well. Dry mouth is another big one. A lot of people complain about dry mouth, especially with antihistamines, some psychotropic medications, some seizure meds can cause a real excessive dry mouth. Then there's other medication you can take to counteract the dry mouth, or, mouth sprays, things like that to moisten it. But dry mouth is a very nuisance type side effect, and a lot of people do have that. Insomnia is another thing that some people experience when they're on medications, not being able to go into that good REM cycle of sleep. So that's another kind of nuisance side effect, but one that if it becomes so bothersome for you that it is affecting your daily life schedules, then you do want to talk to your physician about that. Another thing is some psychiatric type of issues. Some people start to have hallucinations, or they start to be kind of a paranoia sets in. And you see that sometimes with the psychotropic medications, which you're trying to avoid, but sometimes they bring on that type of an effect. Another bad one, and you see this a lot in the elderly, is suicidal ideation or suicidal thoughts, an increase in those when you're on certain psychotropic medications. So your doctors need to monitor that and make sure that if you're having anything like that, you discuss that with your physician and let him know that, these side effects aren't going away, because some of the mild ones, a headache, maybe some lightheadedness, GI upset, that should go away within a few days of being on the medication, at least a week or two. But if it's something long-term that's really impacting you, then you're going to want to let your physician know and see if there's an alternative med they can prescribe, or if the cons of being on the medication far outweigh what the benefit is you would get from it. So that's something else to look into. Reasons you would want to call the doctor or call 911. And I think we have it on the next slide, Missy, if I'm not mistaken. You're muted, so I'm not sure if you're.
Sorry. Yeah, we're going to talk about side effects later in the presentation, but
yeah, because I think that was coming up. So I don't think I had anything else on this one. No, I'm good.
So I'm going to talk about some tips to form good medication habits once you do start a new medication. You want to make sure that you take it as prescribed by your doctor. Not only the correct dosage, but the time of day can be very important. There's some medications that might make you drowsy or might make your mind not work right. You want to take those medications at bedtime. There's other medications that are better to take in the morning when you're going to be up and moving around all day, and it makes them work a little bit better. So you just want to pay attention to what time of the day that you're told to take the medication. With or without food is important. Some medications need food in your stomach in order to absorb properly. Other medications you want to take on an empty stomach. Empty stomach medications are typically just thyroid medications and antacid medications that you would take for acid reflux. Usually like pantoprazole is one that a lot of people will take long term. That one you typically want to try to take before other medications and on an empty stomach before you eat. There's some medications that can't be taken together. So if your doctor or pharmacist makes you aware that there's a medication interaction with another med you take, you might be able to just separate those and take one in the morning and take one in the evening, but you want to make sure that you follow those instructions so that your meds aren't counteracting each other. I personally am really bad at remembering to take my meds, but there are a lot of things out there now that can be very helpful. A lot of people set alarms on their phone. There's apps that will pop up to remind you to take your medication. I have to leave sticky notes everywhere because I ignore alarms. So I make a list every morning of things I need to do, and I'll put that on there that I have to cross it off. My mom writes things on a calendar. You just have to play with different things and find out what works for you. But there are a lot of things out there. Later, I'll show a pill box that has like a Monday through Friday, and an alarm goes off and the box lights up to tell you exactly what day of the week you need to take. It's really cool. There's good technology out there. Whenever you're getting low on your medication, it's really important to try to refill the medication early so that you don't run out. I typically tell people to notify the pharmacy about a week before you run out of your medication. If you try to fill them too early, your insurance company won't pay for it because they said that you just filled it. So typically around that 1 week before you run out mark is usually sufficient time. But if your script is expired, that gives the pharmacy time to reach out to the doctor to try to get a new one. If it's a medication they don't carry often, they can order it. If there's any issues, that just kind of gives the pharmacy time to work out any problems so that you're not running out of your medication. So I try to keep track of when you're going to run out. Liquids can sometimes be difficult because you're looking at a bottle and not just pills you can count. So with any medication that you can't measure, like any liquid medication or like creams that you use every day, I try to keep track of how long one tube or one bottle lasts you so that you know around when the time that you'll need to reorder the next one is. Pharmacies that have automatic refill, it can be annoying because they call you a lot, but it is very helpful because when your medication's running out, you know it's going to be refilled. And when they have medications on automatic refill, they do obtain scripts earlier. They run those medications through your insurance earlier and make sure everything's going to be okay. And then they just call you when they're ready or send you a text message when it's ready to get picked up. And they'll keep your medications at the pharmacy for up to 14 days. That's like a law that they have to do. So when you get a notification that your medication's ready, you don't have to run and pick it up right away. They have to hold it for 2 weeks, but it's nice because you know it's there. One of the big problems a lot of people run into is vacation, especially if it's a last minute unplanned trip to go see family or anything. Anytime you're going anywhere, you want to make sure you remember to bring your medication with you. If you go on vacation and you don't bring your medication, then you can go through like some withdrawal effects because your body's relying on that. If your medical condition makes you sick, you could have those symptoms again. Even high blood pressure, Some people have high blood pressure and never notice, and they get put on meds and their blood pressure is very regulated. If you forget to take your blood pressure meds for a couple days, you can get very quick rebound hypertension and you can feel pretty sick. You can get severe headaches, you can get stroke symptoms. So it's very bad to abruptly stop your medications and not remember to take them for a couple days. There are ways you can get medication, which a lot of people don't know this, but if you fill at a large chain pharmacy, for example, CVS, if you run out of medication and you're somewhere near a CVS, you can go to a CVS and they can give you a couple days worth of your medication. They probably won't be able to run it through your insurance unless you're due for a refill, but you can pay out of pocket and they'll take it off of your script that they have on file for you. Sometimes if it's a different big chain, you might be able to call the CVS or Walgreens or whatever that you normally fill out and have them send the script to a different pharmacy so you can get some of it. But that's a good tip I like to tell people, because a lot of people don't realize you can just go wherever and get your medication, especially if it's something really important. Most pharmacies will work with you and try to get it at least enough to get you through your vacation until you get back home. And then just checking expiration dates. When you get pill bottles, usually it's not too big of a problem. You're usually only getting a 1 or 3 month supply. The pharmacies go through and do quality checks on all their meds and check expiration dates. But liquids and creams and those medications that last you a long time, you want to check expiration dates on those. Over-the-counter medications you buy, if you're just going to go take a Tylenol out of your cabinet, you want to check the expiration date. There's some medications that are very dangerous to take past the expiration date. Aspirin is a drug that a lot of people think is very safe, but aspirin breaks down into salicylic acid, which is extremely toxic. So if you open your aspirin and it smells like vinegar, it's probably expired and you shouldn't take it. So it's good to check those expiration dates before you take things. Even creams, if they're expired, you can get severe reactions from those as well. This is that pill box I was talking about. You can set an alarm for it and it tells you the alarm will go off and the day of the week that it is will light up so that you know exactly which one you need to take. Each of those individual days of the week, and this particular one actually pops out. So if you're going somewhere that day and you're not going to be home, you can take that day out and just throw it in your purse and bring it with you. This one is from Amazon. It's like $30 on Amazon. There's 3 other ones. The rest of the ones I'm going to talk about are typically obtained through your pharmacy. These are little pill packs. A couple years ago, a company came out with these, and now there's several companies that use these. Typically, it's mail order pharmacies. I think Express Scripts does this now. But if you like this, you can Google it, and you can have your script sent to a lot of different mail order pharmacies. You can also have you can also call your insurance company if there's a particular type of packaging option that you want to get. You can call your insurance company and your insurance company can work with you on finding a mail order pharmacy that provides that service and is covered under your insurance. So these pill packs will have like what time of the day you need to take it, the day, the date. And it also describes each tablet in there, which I really like, because if there's a medication that you stop taking, there's a description on there of what that pill looks like, so you can take that one out if you're not going to take it. Or you at least know what all of your medications look like, which is very important. But it has like all your dosages and how many are in there. So you just rip that packet out and it has all your pills for the day. These are blister packs. There's actually a decent bit of community-based pharmacies that will fill blister packs. There's mail order that will do this too, but A lot of the big chains won't, but a lot of the small local pharmacies, if you ask them, a lot of them will fill blister packs for you, if you prefer to go into the pharmacy. And then if your medications change, you can bring your blister pack in, and a lot of them will refill your blister pack if your medications change. I know Health Mart pharmacies, they're more so Westmoreland County, like Lower Burl, New Ken, Vandergrift, Leechburg area, but they all do this. And it's a really nice service, and they'll also deliver them to your house too if you're local. But these, on the back of these blister packs, typically has the same description that those pill packs had, like each pill that's in there, what it looks like, when you should take it. This one has is a weekly one that has like morning, noon, evening, and bedtime in it. Some of them, it's for a whole month supply. So if you take a medication in the morning and at bedtime, you'll have 2 blister packs, one for the morning, one for bedtime. But it just depends on what blister pack that place has available. And then there's regular pill bottles. There's a lot of people have issue with the childproof caps. There are alternatives to childproof caps if you can't open those. When you go to your pharmacy to fill your medications, if you tell them that you can't open them, they can give you non-childproof caps. I know Walgreens and Giant Eagle have the ones that flip over now, but I think CVS still puts a different cap on the bottle depending on what size bottle it is. And then if you have liquid bottles, they can also give you non-childproof caps for those as well. They have to offer that for everything, so sometimes you just have to tell them. Over the counter bottles, you can actually pop anything with that white top. You can pop the white top off, and there's a clear plastic lid underneath of it, and that clear plastic lid underneath will screw on like a regular top. They're kind of hard to get off, but if you're at the pharmacy and you get one of those bottles, if you take it back to the pharmacy, they have a special tool that will pop the top of that bottle right off, and it'll make it a non-childproof cap. So if that's something that's difficult and it's safe for you to have bottles in your house that have non-childproof caps, it's just something you can talk to the pharmacy about, and they can kind of help you with that, and they can alter those bottles for you. Again, you just want to make sure that you don't have like young kids in your house that are going to get into them, or somebody who shouldn't have that medication, who might med seek or take a bunch of meds they shouldn't take. You want to make sure it's safe to do that. But if you're home by yourself, or the people you live with are okay around medications, then it's a good option to have. You should also carry a med list with you. A lot of pharmacies have programs that will print off a med list for you, but sometimes people fill things at multiple different pharmacies, especially if you have a condition where you have a specialty med that you fill that you have to get through the mail or get at a different pharmacy. It's nice to have everything in one place where you can kind of alter that document. You should really include the medication. This includes vitamins. Every single thing you take, you should write down on your med list. A lot of people will forget to put vitamins, even a multivitamin or some herbal supplement. People will forget to put those, but a lot of times vitamins and herbal supplements are the #1 interaction with prescription medications. For example, St. John's wort interacts with almost everything. It's one of those medications that a lot of times, if people's meds aren't working, you have to specifically ask them, and people don't realize that because it's just a natural herbal supplement, people don't always realize that it can cause such a big interaction with medications. So you want to make sure you write every single medication that you're taking. If you're going to a pharmacy to buy it, even if it's over the counter, you should put it on your med list. You should put what dosages you take, exactly what you take that medication for. A lot of medications are prescribed for what's called an off-label use, which is a use that isn't what the medication was designed for. But sometimes meds have side effects that happen to help treat other conditions. There's a blood pressure med that a lot of people take for acne, because people taking it for their blood pressure just realize that their acne goes away on it. Sometimes they don't know why that happens, but you want to make sure you document the condition you're taking that medication for and any special instructions you were given. Again, if you should take it with or without food, if it interacts with one of your other medications, it's nice to just document that so it's on record for you to refer to. You want to bring this list with you to any medical appointments you go to, doctor's appointments, if you go to the ER and urgent care for anything. Even sometimes taking it with you to the dentist's office can be helpful if the dentist is going to do a procedure where they're going to give you an antibiotic. They can look at your med list and make sure whatever they prescribe you isn't going to interact with any of your other medications. You should also make sure you put your allergies on there, because there's a lot of medications that if you have an allergic reaction to, it predisposes you to an allergic reaction to similar medications or medications in a similar class. So it's helpful to have those documented, because when you give that med list to somebody, most prescribers should be able to see that allergy list and know what those correlations are. You should also keep this list easily accessible for an emergency situation. Again, if you're going to go to the ER and urgent care, but especially if you're going to have to be taken by ambulance, you should keep a list in your wallet. Again, there's apps that will let you put this on here. If you have an iPhone, the health app will let you put all your medications in there, your side effects, your allergies, what pharmacy you fill at, who your doctor is. You can put all of that in an app in your phone. And then you can keep that updated, which is nice to have access to. If you have like a MyChart or a MyUPMC account, they also have a med list in there for you that you can use. But those lists, you really have to make sure you keep updated and make sure that medications you're not taking anymore are discontinued off of there. And if, for example, you have a MyUPMC account and a doctor from Allegheny Health Network prescribes you something, you'll have to reach out to your UPMC doctor and make sure that med is added to your list so that that list is comprehensive. So that's why it's nice to just keep your own list, either handwritten or typed or in your phone, somewhere that it's easy for you to update and access, and just make sure it keeps updated every time you change something. Here's just that med list blown up. You can see it has, you want to make sure you put your name on there. This one has an emergency contact number, which is never a bad idea. If anything happens, somebody has that number to be able to update you. And then it has the medications, what strength, how often you take it, what you take it for, who prescribed it, any special notes. You can put your allergies at the bottom, what pharmacy you fill with, and even has room for you to put your drug plan, which is nice to put your insurance information on things, especially because we all know that insurance is sometimes picky about where you go for things. So it's just a nice little list to keep handy. I just Googled this off the internet and it's like a free file you can download. So if you like having a template like this, you can just Google it and a bunch of options will pop up and you can pick whichever one you think works for you. But those are the things I like to see on a med list. And this is you, Carol.
Thanks, Missy. A lot of good information there. Okay, medication storage. Another thing that people often struggle with. A lot of people tend to keep their medications right in a medicine cabinet, as they called them in the good old days, right above a sink. Not a good place to store them, obviously. You know, meds fall down the sink and then you're short pills and you have to, you know, go back to the pharmacy and get those replaced. So it's best to store them in a cool, dry place. Some of the best locations in a dresser drawer, in a kitchen cabinet, away from the stove or the sink, because things like heat, even overall air, humidity, moisture, they can damage medications, even if they are in their original packaging. So you want to be careful where you do store those. Like I said, try to avoid the bathroom, definitely avoid above the stove And I know a lot of people, again, for convenience, they keep it, like right there. And obviously, like Missy said, you want to try and keep those out of reach of others, especially if you have small children or grandchildren, and not using those childproof caps. Because as Missy had talked about, a lot of people, it is hard for them to open, especially if you have arthritis problems or, problems with dexterity of your hands. Sometimes they make it very difficult to get into those. So you want to make sure you do keep them not at, waist level. You want to keep them above so that someone doesn't get into those if they don't need to. The other thing you want to do is try and keep things in their original containers, especially over the counter meds. I've had people come in sometimes and say they have a baggie and they're like, I don't know what this is. Can you help me figure out what this medication is? A lot of people know by now, a lot of times medications will have a code number on them. And a lot of people will Google that number, like say it says A704, and people can Google that and it'll give them an indication of what that medication may be. And it'll give a description of it, but that's not a good way to store it. The best thing to do is keep it in that original container. If it's an over the counter, make sure you're checking the expiration dates because they do expire. They don't last as long as people think. And as Missy had alluded to, a lot of people think, well, it's just aspirin, there's no problem, or it's just Tylenol, there's no problem. So you want to make sure that you check all of those things as well. Next slide, please, Miss. Okay, big question. Can I abruptly stop my meds? Obviously, you see our no with the exclamation point there in red. Abruptly stopping medications is not a good idea. It can cause severe side effects, and it can also affect you in other ways, exacerbate other conditions. Now, a lot of people say, but I just feel so lousy on it. And that's what I was talking about before on side effects. If you can get through some of those untoward effects, like the dizziness or nausea or a headache, if you can get through and kind of weather those effects a bit until those things calm down and then you start to feel a little better on it, try to stay on that. You should only stop something abruptly if you're told to do so by your doctor, or maybe you're talking to your pharmacist and they recommend that you stop it. Otherwise, you should call your physician and let them know if you're starting to experience things that aren't making you feel well. Most people report if they think on their own, okay, if I'm not feeling good and I just stop it, it'll be okay. I'll just tell them next time I go back to the doctor in 3 months, I'll let them know that I abruptly stopped it. You don't want to do that. A lot of medications, like I had alluded to earlier, you get an established blood level. In other words, they break down and they cause a therapeutic level in your blood that helps maintain that condition. So you don't want to mess with that, because obviously if you stop the med abruptly, the blood levels can change quickly and you won't be feeling as well. Some of the most dangerous meds to stop, quote unquote, cold turkey, is blood pressure meds, because they can definitely predispose you to a reversed hypertension that comes on again because you've abruptly stopped that. Seizure meds, those are another one that have a blood level associated with them that you do not want to stop abruptly. You can have breakthrough seizures occurring. Some people still have breakthrough seizures even on seizure medications. And that's something that you also want to alert your physician to, because it may be a point that a person's been on something for so long that they've become a little more tolerant. So they need to change the dose on it, or they need to look at a different seizure med. So you don't want to stop those abruptly. Steroids is another one. A lot of people are prescribed steroids, severe poison ivy, some severe respiratory infections. Steroids are the kind that they'll tell you take, you take a loading dose and then you take so many a day for the next day and you start tapering down. You don't want to just stop those. They're another medication that has a lot of untoward effects if you just stop those abruptly. So you want to make sure you follow that titration on down. Some of the things you want to look at, if you suddenly stop things, what you might experience is headaches, unsteadiness on your feet. Some people get sweats, they break out in like a cold sweat. It's almost like a drug withdrawal type symptom. They get GI upset, where their stomach might be upset, or they have cramping. They can also have confusion or agitation, go maybe the opposite effect. Say if you were on a mood stabilizer for a long time and you just stopped it, you may go the opposite effect like we had talked about earlier. If you're on antidepressants and you suddenly stop them, you can come back with even worsening depression after that. So that's why it's important to make sure that you are doing what your doctor prescribes for you to do. Another thing you need to think about is if you're having a severe reaction, if you have a severe symptom occur, you want to go to the emergency room immediately. Severe reactions being you feel like your throat's closing up, your lips can swell up, you can have difficulty breathing, you can develop severe rashes almost over the entire body. Some turn into big welts and hives, others are just, like just covered in rashes, even into their, face, into their mouth, things like that. So if you see something like that, where you're having trouble breathing, you're feeling like you have numbness and things around your tongue, your lips, you're having sensations in your hands or sharp pains in your head, your upper body, that's something you definitely want to get to the emergency room, whether that's a 911 call or someone takes you immediately there. If you have those mild things I had talked about earlier, maybe a headache, maybe some nausea, cramping, things like that, that's something you can let your physician know. It's not necessarily a trip to the emergency room, but it's something you want to let them know because it's bothering you enough that maybe it's going to cause you to not want to take that medication. So you want to make sure that you discuss that with your physician, and then you can look at a plan that might be a little bit better fit for you. Next slide, please, Ms. Okay, this is what we were talking about, was how are meds safely stopped. Titration is when you're slowly changing a dose over the course of time. It can be a couple weeks, it could be a couple months. A lot of times with psychiatric meds, psychiatrists need to look at those at least a minimum of every 3 months and decide if there's still a therapeutic fix for the condition. If not, they need to look at changes of that. And I gave you some of these examples we talked about. Some of the symptoms you could see if you suddenly stop something. Sleeping trouble is a big one. Tremors is another one. A lot of time people have tremors just with long-term use, and that is called extrapyramidal symptoms. You may have heard people talk about blinking, excessive blinking, or they call it clicking, or movements with their tongue, or repetitive tongue thrusting, things like that. Unfortunately, those are not good effects, but you see those a lot of times with some of the psychiatric medications that you may take. A lot of times to kind of stop that, you'll get fine tremors of the hands or even of the head. They'll put you on another medication. Cogentin is one that they use that, kind of counteracts those effects. It may lessen them a bit, but some people still have those. Sometimes it gets to the point where physicians will change that medication because the effect gets to be so bothersome for the person. So those are something else that you want to kind of keep an eye on. If you're starting to experience that, you definitely should let your physician know, because some of those effects sadly can become permanent if they're not addressed. So you want to make sure that you're keeping an eye on those as well. Next one, Ms. Okay, what to do if you have a severe reaction. I kind of talked about this a little bit. Call the PCP. If you have just itching of the skin, obviously not severe, as you can see in the picture there. If you have a headache, if you have minor aches and pains, if you're having some of those digestive issues I talked about with the stomach upset or nausea, you could even have some vomiting a little bit and then it could cease. But those are things you want to call them. Severe reactions, like I talked about, difficulty breathing or chest pains, swelling of the face or throat, severe vomiting, meaning uncontrolled. It just can't stop. It's just constantly vomiting. The hives, which you see an example of there, and confusion, hallucinations, as I had talked about also a little earlier, that you may see with medications. Those are severe reactions that should not be occurring. So if you're seeing any of those, you want to call 911 or immediately get to the emergency room for treatment. And this was just a picture to show some of the reactions that you may see. Obviously very severe there on the arms and on the child's face there. A lot of people, it can indicate an allergy, especially with antibiotics. People will get rashes. Some people goes away in a day. Some people gets worse and worse progressively. And a lot of times the directive from the doctor will be to stop the medication, and they'll give some Benadryl to kind of reverse some of these symptoms. but this was just to give an example of what a reaction may look like on the skin. You're muted, Miss.
Thank you.
Sure.
So here I have some medication disposal options. This is something that gets asked about a lot. And there are a lot of options for medication disposal that people aren't aware of. For insulin needles, or anything that you get injected, there are other medications, but typically the ones at home are some sort of insulin or diabetes medication. You don't want to throw those needles directly in the garbage. One, it could pose a risk to the garbage people when they're throwing those bags in the garbage truck. They could stick themselves with a needle. Or also there are people who will try to rummage through garbage to look for needles. So you don't want to throw them directly in the garbage. You can put them in like a coffee container or some sort of plastic container with a lid and tape that lid shut and put that in the garbage. But there are also these Sharps container mail-in services that I think are nice if you do go through a lot of Sharps and you can budget it. This one, for example, is only $32 a month, but they will auto ship to you. So they'll send you one of those containers every month, and that box that they send it in is already like prepaid to send back. So you put that container, once it's full, you put the lid on it, you put it back in that box, it reseals shut, and you send it back to them, and then they auto ship you a new one. So you can see there's different options. You can do monthly, bi-monthly, quarterly. You can just do a one-time if it's a short-term medication. But I think it's a nice program for medication disposal because they can get rid of those medications more appropriately than just putting them in the garbage. For pills, creams, liquids, there is a drug take back program. You'll often hear about police stations, fire departments, sometimes schools will do a drug take back day, and you can bring in any expired medications, over the counter prescription, no matter what it is. You bring it in, they'll take it, no questions asked, and they'll dispose of them properly. But there are drug take back locations that have a box, and when you walk inside, usually it's right in the front door. They'll have a box that is almost like the big blue mailboxes. You put it in, and then when you close the door, it drops into a locked box, and you can't reach back in there and get anything. But I have, this blown up. If you go onto this website, you can search any town you want. I searched Greensburg and Pittsburgh just to give some examples of what has them. But you can see the Westmoreland County Park Police Office has a box. Westmoreland Hospital, City of Greensburg Police. If you search Pittsburgh, also police, but the public safety building, there's a couple pharmacies around. You can put in wherever you want in whatever mile radius. And these are locations that have a permanent box inside the facility that will allow you to dispose of medications there. So that's a good option if you have stuff that's expired. A lot of people will keep a little container in their house, and once it's full, they'll bring it in. But if you have prescription medications that you're not taking anymore or are expired, I highly recommend taking them in as soon as you're not taking it anymore, just so you don't accidentally take anything you shouldn't be taking. Most pharmacies won't take your medication back once it leaves. They don't have a proper way to dispose of those medications. So most of them won't take it. Usually you'll have to take it to one of these drug take back locations. In case of an emergency, these are just some tips on how to maximize safety. EMS may not always take the time to find your medication. A lot of EMTs are trained to just go in, assess the situation, get the person to the hospital, which is the best for you. But oftentimes it might be really good input if they know what kind of medications you're on, what kind of medical conditions you have. Typically, they can look that up once you're in the hospital, but it can really give EMTs a lot of insight to be able to treat you on the way there and figure out what's going on. So there's a lot of different programs. There isn't really anything that's standard in our area, but there are ways that you can just kind of increase the chances of the EMTs being able to see or get your medication list and bring it with you. There's, I don't know why my pictures of I have them later. There's different medical alert bracelets that I'll go over in a couple of slides that you can list emergency contacts, your medical conditions. There's even ones that you can put a QR code on, and that QR code will scan to a medication list. So you can keep that medication list electronically updated, and somebody can just scan that QR code on your medical alert bracelet to see your updated medication list, which is one of those things, like, technology is really cool. There's a lot of places that have this Vial of Life program as kind of standard in the area, but it's one of those things that you can do anywhere, and a lot of times it will catch the attention of emergency responders. So this is what the Vial of Life sheet looks like. Again, this is just something I Googled, and you can just print it and fill it out. You can pay for the program. They send those little Vial of Life stickers to you. You're supposed to put one on your front door about eye level, and then one on your refrigerator on a magnet. And then when they come, they'll see that sticker on your front door, and they'll know that you have medical information in the house that's easily accessible for them. They can just go and grab it, and they don't even need to read it in the house. They can read it once you're in the ambulance. They can just hand it to the ER, but it will have important medical information. So on here, not only does it have emergency contacts, it has a lot of identifying information about yourself, which is helpful if you're in a household of multiple people. You probably aren't going to have your ID in your pocket if you're just at home. So if there's multiple people in your house, it's nice for them to know for sure who it is that they're treating. But it can also just give some insight into whether you have hearing deficits, vision deficits, if you have a pacemaker, what your baseline vital signs are. That stuff can be very important to EMTs to know kind of what they're dealing with. It has a little checkbox for any medical conditions you might have, and you can write in anything else that might be important. There's room on there for a list of medications. Again, you need to remember to keep this updated. So anytime your medications change, make sure you update your form. But you can also put your insurance information, your preferred hospital. It's nice to have on there whether you have a living will, order anything, just so that they know that that's something to look for when contemplating what treatments to give you. So this is a lot of medical alert equipment. These are a special seat belt cover that you can put on. You can get these for a lot of different conditions, but I think it's nice because it just says that this person has special needs. They might not be able to respond to you. They might not be aware that they're even in danger. They might resist you helping them. So if you're in a car accident with someone who's nonverbal or might have poor situational awareness or isn't good with strangers, sometimes it's nice to have that just so the EMTs know that that person's response isn't a head injury, a concussion, a traumatic brain injury, and that that person has special needs, and it can kind of help them to better deal with that situation. There's also a lot of different options for medical alert bracelets. So I just shared a few here. There's a bunch on Amazon, Etsy. You can get them in all different styles. You can get them customized to say whatever you want to. This one's a pretty typical medical alert bracelet, but you can see it has that he has a couple medical conditions. He uses steroids. Those are important things to know if you're in a crisis and EMTs find you and there's no one to report your medical condition. It kind of just gives them a quick glimpse into what might be going on. These ones are cool. They're just like braided bracelets, but I think that they give the option of kind of just a more unique look instead of that bland medical alert bracelet. I feel like the last medical alert bracelet, a lot of people see that and know what it is. But this one just might be something that people are more willing to wear. Typically kids want to wear something that is a specific color, but you can get these in all different colors, shapes, sizes. You can get different pictures on there. So it's nice to have options, to have something that somebody will wear, because it's important, especially with the ID community, people who are nonverbal, people who have issues, like even epilepsy is a big one. If somebody has a seizure, it can really help to guide treatment to know whether that person has a seizure disorder, or if it's their first seizure. So that's just important information to have on hand. And then this one's cool. It's actually just a little metal clip that goes onto like an Apple Watch band. So a lot of people wear Apple Watches, smart watches, and don't like having a lot of other bracelets on their hand. So it's nice if you do wear an Apple Watch. You can put that right on an Apple Watch band, and you don't have to wear an additional bracelet, but it's there with an emergency contact and some medical information for people. I was also asked to touch briefly on genetic testing. This is a very complex topic, so I tried my best to kind of break it down and give people some tips on when this might be pertinent to them. But if it's something you don't understand and you really think it might be important for you, the best takeaway from this is just to discuss it with your doctor if you think that it's something that might be helpful to you. But certain genetic disorders can affect the enzymes that break down your medication. So they will affect the way your medications work within your body. So genetic testing can help to tell what types of enzymes are in your body, or sometimes can even just narrow down exactly what genetic disorder you have, and doctors can look back on research to try to figure out what medication regimen typically helps that condition best. But enzymes are in your body and help to break down and absorb medications. So that's what breaks down anything that you eat, drink, any medication you take. Those enzymes are what breaks that down and makes your body absorb that into your bloodstream. So any changes in these enzymes can affect the way that your medications are broken down and absorbed in your body. So if you think that the medications aren't helping you, especially if you're somebody who typically has to take very high doses of medications, or a lot of medications just seem like they don't work for you, or if you get a lot of severe side effects from medications, if you're somebody who has to be very careful when you start a new medication, or very careful about what you take, or you have a lot of medication allergies, genetic testing could be helpful in just knowing exactly what genetic condition is causing that. And sometimes that can just really help to guide medications. This is very complex, but cytochrome P450 is a specific set of enzymes that are responsible for metabolizing over 90% of drugs. So there are 50 enzymes in this group, but only 6 of them will metabolize 90% of medications. So if you have a genetic condition that will affect one of those 6 enzymes, then it is very highly likely that you will not respond to a lot of medications. You might have severe side effects, and it will really affect the way that your body breaks down those meds. So again, if you have a genetic condition especially, but even if you just don't respond to medications well, it might be worth asking your doctor to do genetic testing to see if you have a condition that affects this. And they can test for this group of enzymes specifically to see whether you have a genetic abnormality surrounding those enzymes, and it can kind of help to guide medication adjustments. And that is all.
That was
Wow,
amazing, and I
fantastic.
have so many notes, and I'm really happy I worked with both of you because it makes me feel like I learned a lot and I'm with smart people, and that makes me happy. So
Thank you.
anybody have questions or ideas? Who else is on the call? Want to ask anything?
We had talked about before the presentation about the cascade. Just like a quick tip, do you have any suggestions for someone who thinks that there might be interactions with their medications if they're getting them from multiple doctors?
Yeah, I can touch on that. I know just from my pharmacy experience, if you fill all your medications at the same pharmacy, you can ask your pharmacist to do a medication review, and any major interactions, if there are major interactions between medications, your pharmacist will not fill them. But there are a lot of medications that interact with each other very minutely, and some people are more sensitive to those interactions than others. So if you're on a lot of medications from multiple different doctors, I personally suggest people going through their pharmacy and having the pharmacist do a medication review, and that pharmacist can kind of go through your medications and list all the ones that have mild side effects and what those side effects might be. And I think it can really help to identify which doctor you might have to go to talk about the medications that are potentially interacting with each other. There's a lot of doctors who, especially specialists, when they get into like their niche of medicine, sometimes won't really respond to you when you try to do that. So sometimes if you can go through another healthcare professional and say like, hey, I had my meds reviewed, and like research says that these medications don't go well together. Is there something I can do? That can sometimes be a little bit more helpful in getting doctors to take another look at your medications. I also often recommend that people, again, especially if you're somebody who's very sensitive to medications or on a lot of medications, or you think that your medications might often cause problems with each other, I think anytime you start a new medication, it's really good to document what side effects you're having and how you feel every day. And that can really help, especially if you have like multiple medical conditions and you're going to multiple doctors and you're getting multiple medication changes. If you can document like when you started a medication and document how you feel every day and just take that back to your doctor, they can go through there. And sometimes it's hard because if you started medications very close to each other, you might think that it was the last medication you started, but really it could be the medication you started last month that's starting to cause side effects now. So being able to kind of track when those side effects started and take that back to your doctor, they know when medications will start to affect you, when those therapeutic levels are in your system, and that can help to kind of identify which medication might be causing an issue. I don't know, Carol, if you have anything to add to that.
No, I was just going to say the other thing you can do, and sometimes it works, sometimes it doesn't, is requesting the physicians to speak to each other, whether that be a specialist like Missy had alluded to and your PCP, or psych and PCP, because a lot of times, as we were talking, Tammy and I, before we started today, a lot of the physicians just prescribe separate. They don't even look at the overall picture. And that's a shame on them type thing, because they really should if they're getting a detailed medical history. But in this day and age, when speed is of the essence, and I can see 24 people if I speed it up as opposed to only seeing 20, they tend to do that. But you do have the right as a consumer, and according to a lot of the health regulations, to ask the physicians to discuss that with each other. And is there something that can be changed or discontinued, quote unquote, added, or something to counteract those side effects? And it takes a strong person to do that. A lot of people don't want to challenge a physician. So that's where nurses come in pretty handy and helpful. We do help the community supported living program with that a lot, because we're the ones that intervene, and we'll have those conversations with those physicians and try and force them to, kind of take a hard look at meds sometimes. And we found Missy, how many pages were there? 30 some pages of medications that people were on, that have been on, some of them since like the early 2000s. And they're just the physicians are just reordering, and it may not even be something that's even necessary anymore. And more than likely is not. So we've been weeding through those. It's just hard to get them to listen to you sometimes. I know we've all had those experiences. Even nurses have those experiences with the doctors too, but.
Sometimes too, if you don't have access, if you don't have, like, people who are supported by Achieva can come to the clinical team and we can assist them with that. But if you don't have that service, sometimes if you go through your insurance company, I think a lot of people underestimate how helpful insurance can be if you can utilize it appropriately. But I often tell people, call the insurance company, because they have a consumer health line. They often have nurses that work for them, pharmacists that work for them. And if you call and ask them to do a medication review, sometimes they'll go through your meds, and sometimes they'll even fight with your doctor for you to get your medications reconciled into a shorter list, because obviously they don't want to pay for all of them if they don't have to. So they have an ulterior motive. But if you think your medications are interacting, they're gonna look at them and make sure they don't take you off of anything important. But if there's things that, like, often the problem is you're on a medication and it causes a side effect, so they treat you for that side effect, and then that causes another side effect and they treat you for that, and then you end up on all these meds. But if you can get someone to figure out where that started and just get that initial medication changed, then you could potentially cut out several other medications. But it's worth at least reaching out to the insurance company. They might be able to refer you to somebody who could do that for you. But sometimes almost every insurance company has a team of healthcare professionals, doctors, nurses, pharmacists, who will do that kind of stuff. And sometimes they can argue with your doctor's office for you to get that taken care of.
I was just reading a really quick article. I've always heard about, like, don't take this medication with grapefruit juice. I thought it was because I might get indigestion, and then I read an article that told me differently. So does anybody want to talk about why that could be? Why grapefruit juice, or what it does, I guess, what it could do?
Go ahead, Ms. I didn't want to trample on. Go ahead.
You can, if you want.
You got that pharmacy background for a reason.
I feel like grapefruit juice is just another one of those, like, to me, it kind of falls in that herbal category I talked about earlier, how a lot of herbal medications just kind of interact with things. Grapefruit juice, I believe, is because it has a very high acid content compared to a lot of other fruit juices. And there's certain chemicals in grapefruit juice that other juices don't have. And I don't know them off the top of my head, but I know that it contains certain types of acid that aren't in other fruit juices that can just completely make a medication stop working.
Yeah.
They break it down differently. Like the acid breaks the medication down.
It'll metabolize it too fast, and then your body just excretes it. Because if you metabolize a medication too fast, then your body doesn't have a chance to absorb it in the intestinal tract, and you'll just excrete the medication. So grapefruit juice can kind of make that happen as well. And it can alter certain medications so that what you are absorbing isn't the intended medication. And oftentimes it doesn't really cause side effects, but you're just not taking the medication. You're taking a broken down version of the medication, so you're not getting that therapeutic effect that was intended from it. Medications that you shouldn't take with grapefruit juice, a lot of pharmacies will put a sticker on your label that says not to take it with grapefruit juice. So if you see that, it's not because of heartburn. It is right. Because that is a common thing. A lot of people think that it will just cause some acid reflux or something, but no, it can actually potentially change the chemical makeup of the medication you're taking.
Yeah, I learned something new.
It's kind of like people that just take extra vitamins. I'm feeling sick, so I'm going to take 4 vitamin C tablets. And like Missy said, your body will just immediately excrete it. You're not really getting that benefit. It will only absorb. Your body's smart and will only absorb what is needed and it'll automatically excrete the rest. But some people do that. Oh, I took a loading dose of vitamin C and I took, all these other, and the media is great for recommending everything. You hear a lot about magnesium right now. You're hearing a lot about, we were talking about meds that have different uses. Ozempic. People are begging for Ozempic from doctors for weight loss when people that are truly diabetic and using it for that purpose can't get it because it's in the short supply now because everybody's using it, because weight loss is a side effect of it. People are using it for that use. So there's a lot of those drugs that fall into those classes, like we had alluded to before too, that then they go into a short demand and people that truly need it for the medical management of a condition, can't get that anymore. So worth watching.
Well, I think this is great, and I think it's okay to stop where we are, and we're definitely going to share this with a lot of people who couldn't be here because they can watch it on their own time.